amplifying you.
What motivates me is I always remember that first patient that I need to tell that he will never walk again. I felt so hopeless that I decided I need to do something about it. I'm assistant professor at Physical Medicine and Rehabilitation Department at Cornell University. And I've been part of the non-invasive brain stimulation and human motor control laboratory here at Burke. I'm a clinical scientist, and I've been studying for the past 7 years how the brain and the muscles connect to each other in people that they suffer some kind of disorders like a stroke and spinal cord injury. I use techniques like non-invasive brain stimulation and robotics to try to not only understand how that pathway works, the one that controls motor systems, but also how can we deliver therapy to make those people that they lost the motor function to move again. So the conventional therapy, like physical therapy and occupational therapy, we were very aware of those techniques, but we needed something else. Well, we have been fortunate enough to have the exoskeleton with us for a few months now, and everybody's very happy with it. I think that these devices, they have already proven that they can be used for gait rehabilitation. We are fortunate enough to be part of this first trial that Ekso is doing to test if this protocol that we are going to be doing with patients with incomplete spinal cord injury are able to regain gait function better when comparing with conventional therapy. So rehabilitation, if you think about it, it's a very hard thing. You have an injury or you have an accident, and suddenly your body, your brain, your spinal cord stop working. And the rehab process starts right after you are awake in a hospital bed. And it takes months, sometimes years, sometimes a lifetime to go back to the person that you were before, or to adapt your new reality to what you have left. This is a very exciting time right now because of all the emerging new technologies that are out there. Now we don't do like very boring repetitions. We use video games with our patients. We put our patients into robotic devices so they feel like they are Robocop or Iron Man. They are not only getting better, but they are also having fun. So their rehabilitation process is changing tremendously, and this is a very exciting time for that. Working with patients are doing like a gait training program is kind of not only time consuming, but also very physically demanding. For them to be able to take out a little bit of that burden, it was very important. So the exoskeleton helped them doing their job better, I believe, and they were excited about that. But also to see how excited the patients were to try something that they describe as new. Everybody wanted to try it. We are trying to see if after these 36 sessions of using this robotic device for gait training, all patients are able to enhance their gait speed. I think the future of neurorehab is going to involve many different things, and robotics or new technologies is going to be like a big part of it. As a neurorehab doctor, I really believe that there is not going to be one approach that is going to work. So I think that physical therapy, occupational therapy, human contact is going to be very, very important for rehabilitation, but we're going to need new things. So I work with people, and those people, even if they had like terrible things happen to them in their lives, they are always cheerful and they are always asking me, "What's new, doc? What else do you got?" So I need to keep up. I need to, keep coming up with new ideas, working with more people, using better technologies, and pushing boundaries to come up with things that they will make them better. That's my inspiration.
Take the next step with us.